Good morning, everyone, and welcome to day 2 of Maine Public Health Association's annual conference, Dirigo, Rebuilding and Moving Forward Together. This is Heather Drake, the membership manager with MPHA, and I'm excited to welcome you all back for another full day of programming and learning and networking. We start this morning with a plenary panel called Creating Connections Through Disruption, How Public Health and Economic Development Are Intertwined. And we're joined by our moderator, Kristina Egan, the executive director for the Greater Portland Council of Governments. Before I turn it over to her, just a couple reminders. There is closed captioning available, so you'll be able to see that below the video. And if you don't need it, you can click the pause button to stop it. We encourage you and really ask you to all please take the evaluation that is accessible via the feedback button in the upper right-hand corner of your screen. We will be taking questions as part of this panel, so please use the Q&A throughout and we'll answer those after all of our panelists have presented. And a reminder that this afternoon, later today at 4 is our poster reception. So please take some time during breaks today to watch the posters, and you can access the poster reception by navigating to the agenda and then clicking there, and then you'll see another link to get into a Zoom meeting and you'll be into the reception to ask questions of our poster presenters. But without any further ado, I will turn it over to Kristina. So thank you for being here.
Good morning. Thank you so much, Heather. We are really excited to have a fantastic panel this morning. As we all know, being healthy supports our happiness and our well-being. It helps us be there for friends and family and be active in our community. And it also supports Maine's economy. We need healthy people for a healthy economy. This panel will illustrate and explore the connections between public health and economic development. To have healthy Mainers, we need to address the structural determinants of health. And these include things such as food access, educational opportunities, childcare, access to healthcare, housing, transportation, broadband, and more. The pandemic has put major challenges in each of these areas into stark relief for all of us. And we've also seen some catalyzed, innovative approaches and solutions from people on the front lines of these issues and in the public health field. Our panelists are also going to identify for all of us what public health professionals can do to integrate public health into all programs and policies. I'm really happy to introduce our panelists today. Our first panelist was supposed to be Dixie Shaw, and she's the Hunger and Relief Services Director for the Catholic Charities in Aroostook County. She's been on the front line of providing food to people who need it in the county. Unfortunately, this morning, her broadband is not working, which is another indicator of the lack of access that people have to places like this and to many more other opportunities. We had the benefit in a prep session of the panelists hearing about her experience. She had many challenges as she was working to deliver food to her clients in the county. And that related to healthcare access, that she saw the issues that people were experiencing, childcare disruptions, as well as transportation, inadequate transportation. I'm really sorry that she can't be here today to explain her lived experience and give us a really on the ground feel of what she went through. But we are joined by four other excellent panelists who are going to help us better understand the interconnections of these social determinants of health and the economy. We'll first be joined by Jen Gunderman King. She's the director of the Maine Area Health Education Center at the University of New England. She's been working on workforce development issues in healthcare and has seen firsthand what the workforce shortage is looking like in the healthcare field. Then we'll hear from Hannah Pingree. She's the director of the Governor's Office of Policy Innovation in the Future. She's managing a large portfolio of initiatives that support the health of Mainers, including addressing opioid misuse disorder, climate change, and much more. And then we'll hear from Deb Deatrick and Lisa Miller. They are the co-founders of the Maine Alliance for Health and Prosperity, which my organization is very happy to be part of. They have both been working in the public health field for decades, working to change the system in order to improve people's daily lives. I'd like to welcome Jen to the screen.
Thank you, and good morning, everyone. Thanks for joining us on this Wednesday. So thanks for being here. So as mentioned, my name is Jen Gunderman, and as Director of Maine Area Health Education Center Network, otherwise known as AHEC, My niche for this panel is to address health profession workforce and its relationship to the economy and public health. As I prepared my remarks, I thought, what is the key message that I want to get across? Well, no one working in health professions means no economic development, even economic travesty, resulting in horrible health outcomes. That sums it up. Done. But I knew that I could not get off that easy. So I turned to the social determinants of health model for inspiration. In the model that is such a cornerstone for public health, economic stability includes employment. So there we go. That sums it up. My part of the panel, done. But I knew that I couldn't let you off that easy. And then my mind drifted and I thought about how much I loathe employment data. I'm an epidemiologist by training and practice, so my mind often roams and daydreams about data. I have even been guilty of using unemployment data as a health indicator. How many times have we waited for bated breath on job growth data? And yes, employment data can be useful, but we need to be very clear that employment does not equate to healthy individuals and healthy communities. In thinking about workforce, economy, and public health, I want to take this time to advocate that we examine three factors: workforce shortage, workforce job satisfaction, and disparities in the workforce. Health profession workforce shortages is not a new concern. Maine, for many years, has been home to ongoing healthcare workforce shortage areas. Every county in Maine has at least one federally designated medically underserved area or population just for primary care. The list grows for dental and mental health providers. Just about every news outlet in the past 24 hours has some story or headline that relates to workforce shortages in the health professions. And according to an article by de Beaumont, state and local government health agencies have lost at least 40,000 positions, more than 1/5 of the total workforce since the Great Recession. Health profession workforce shortages are due to a number of reasons: more people retiring than entering, cuts in funding, freezes on job creation, expensive educational programs, a pandemic. A growing reason for people leaving the health profession workforce is stress, burnout, and mental health struggles due to work. This leads to my second factor, job satisfaction. According to a 2017 pre-pandemic report by USM, looking at RN or nurse job satisfaction, nearly half of nurses surveyed considered leaving the field due to feeling overworked. According to the National Center of Biotechnology Information, physician burnout rates are as high as 40% nationally. While no data exists, we can absolutely assume high rates of burnout from paraprofessionals such as CNAs, EMTs, community health outreach workers, and others in the public health workforce. Concepts like moral injury and compassion fatigue are gaining attention as root causes for health profession burnout and a dwindling workforce. And this leads to the third factor, disparities in health profession workforce. National data reports the significantly high exit of females from the workforce due to the pandemic. For many years, on average, Black women in the United States are paid much less than white and Black men and white women. Research finds that LGBTQ+ communities face increased harassment and discrimination in the workplace. While there is little research on how these disparities translate into the health profession workforce, it is absolutely not a stretch to say that they do. So like most things in public health, addressing workforce challenges can feel like needing to move a mountain. However, there are small steps that we can take to lead to improvements. And the first one that I offer is promoting caring for our workforce. Ask our workforce, what do they need for physical, social, and mental well-being to do their job? To then create institutions and workplace environments to support what is needed. Second is that when developing policies that address health profession workforce challenges, that we step back and we ask the question, in this policy, where could disparities be created or made worse? Who is benefiting from this policy and who is not? And are we okay with those answers? As we look for ways to improve health beyond the social determinants of health and into the structural determinants of health, we have a fantastic opportunity to make things right, fair, equitable when it comes to workforce policy. Thank you for having me as part of the panel.
Thanks so much, Jen. That was terrific. And thank you for laying such a great groundwork for our discussion about disparities today and how we can achieve more equity. I am so excited to say that Dixie has been able to phone in from her iPhone, and she even has a video on. So she's been able to manage the broadband challenges this morning. And we're going to go straight to Dixie now. We were supposed to start with her so she could provide kind of that lived experience background. And I'm very happy to welcome her to the screen. Hi, Dixie.
Hello, are you able to hear me all right?
Yes, we can hear you.
Okay, good, because I'm checking, because I'm really challenged with the technology issues that we've been having, and I apologize for being a bit late, but I'm here, and I would like to tell you all, thank you for inviting me as well, but I want to tell you a little bit about boots on the ground here in Aroostook County. We have 2 food banks. We're the only food banks north of Hamden. We have one in Monticello that serves the central and southern Aroostook areas. And then we have one in Caribou that serves the northern Aroostook areas. And we have increased our freezer capacity as well as our fresh capacity and our dry storage. We have loading docks, forklifts, and trucks. So when the pandemic hit, we were in really good shape as far as infrastructure went. However, the challenge, as it always seems to be in rural areas, is transportation to get food, get people to the food. So we participated in the Farm to Family Truck to Trunk event, which was a federal program that we participated in, passing out over 66,000 boxes of food in a 10-month span. And we served Washington County, Aroostook County, and Northern Penobscot County during that time. But that was in addition to our regular work of serving the 28 food pantries that we currently serve in Aroostook County, the northern tip of Penobscot, and the northern tip of Washington County. And we also partner with Aroostook Agency on Aging and continued to pass out the senior food boxes that they each get. We have 1,755 of those that go out each month to people 60 years old and up who qualify, as well as Meals on Wheels. We receive and store their product since it's frozen now. So we have a lot of regular work that we do on an everyday basis. And then we added in the pandemic and the truck to trunk and farm to family food options. We also, with our regular distribution to our pantries, we are currently serving 2 healthcare facilities. One is Fish River Associates, takes care of the St. John Valley with 3 locations, and also currently with Fort Fairfield Health Center. And we were working with Pines, but they were unable to continue, and hopefully they can pick that up at some time, because I think it's really important that when you go into a doctor's office for a visit, they'll ask you if you're safe and, that kind of thing. But they also ask you if you have enough food, if you need any assistance with that. And it really is nice if they have some right there that they can give to the person. And also the other issue is when people are discharged from the hospital, especially those who are alone, they go home alone and they may not have groceries. They may not have the ability to get groceries. So a food box, or even better, a Meals on Wheels opportunity might be an option at that point. So it's important to their healing that they not have to worry so much about their food, and they can eat the things that will help them heal quickly and get back on their feet, hopefully. So I think that basically I just wanted to let you all know that our infrastructure that we have spent years building here at Catholic Charities in Aroostook County was vital in the services that not only we provide in Aroostook County, but also people like Aroostook Agency on Aging, other entities. I mean, we work with emergency management. We store water for disasters and any other things. We're staging site in Monticello as well as Caribou. And I think that I had a vision many years ago to have a food bank in Aroostook County. When I started this job, it was a food pantry. The difference between a food pantry and a food bank is that a bank serves the pantries. And sometimes those words get interchanged as if they're the same, and they're definitely not. But we have trucking, we have warehouses, we have our licensed climate controlled facility, trained staff, as well as volunteers. So that's what we bring to Aroostook County. We've shared a lot with Washington County. During the pandemic, we were down there with the truck to trunk stuff, as well as Northern Penobscot. So when we have fresh vegetables and fruit available, which we have a lot because the trucks all have to go by our warehouse in Monticello, and oftentimes we get tractor trailer truckloads of fruits and vegetables and other items that are edible and nutritious, because we have the capacity to unload, and we have the capacity to store, and we have the capacity to distribute. And yes, it would be nice to have a location in another site, such as the St. John Valley. But right now we've got 2 locations, and we were in pretty darn good shape when we had to really ramp things up with the pandemic. Thank you.
Dixie, thank you so much for sharing that information about the great work that you've been doing in 3 different counties. Building such infrastructure. We'll definitely want to explore with you during the question and answer a little bit about how the pandemic made things more difficult and what are some of the challenges that are related to food access. So we're looking forward to that. And we're next going to hear from Hannah Pingree. So I'd like to welcome her.
Great. Well, thank you, Kristina, and good to see you all. And I really just want to actually start by thanking the organizers and all those watching, hearing Dixie's stories. And we heard a little bit from Dixie in our pre-session too. I mean, people have really stepped up and done so much heavy lifting during this pandemic. Probably public health and healthcare workers are at the very top of the list. So as a person working in state government, I think we're all feeling a little burnt out and tired, and yet trying to really motivate to meet the challenges that are in front of us. But I know that I really just wanted to start out with a major message of gratitude and thanks, because I think it is really what we've all hopefully understood, the heroes that you all are, because it is clearly we've gone through, I've stopped counting, but more than a year and a half of an unprecedented pandemic. And it really has sort of changed the way I think many of us think about the importance of public health. So I just want to, briefly talk about the work of my office on behalf of Governor Mills, a couple of our major projects, but mostly how they relate to our economy and to people's lives. And I'll try to keep it short. So my office spent about a year staffing the Governor's Economic Recovery Committee, which was a group that was put together in May of 2020. So at that point, we sort of thought the end of the pandemic was in sight, and we wanted to start to convene a group of leaders across the board, thinking about how do we get our economy back on track as the state recovers. That group met through the summer, through the fall, and came up with recommendations that became the basis of a lot of the work of the past legislative session and the funding that we are now spending coming from Washington through the American Rescue Plan. But through the course of that, the sort of repetition from one of the both of our chair people, Josh Broder and Lori LaChance, was that really the foundation of our economic recovery was public health. And I think that's probably a very obvious thing to public health officials, that public health is key to our society, but for really primarily a group of business and political leaders to just recognize that we won't have an economy without public health. And I think that is clearly obvious. It's an obvious fact of COVID. We all saw what shutdowns meant for schools, for our businesses, for every sector of our economy. It was very obvious that COVID and public health was crucial, but I think it really is a lasting lesson. Obviously, we all still are hoping to see the end of this pandemic and recovery across all sectors. But I think the basis of public health as the key to all parts of our society are now, I think, starting to sink in. And I think as many folks, I'm sure, listening and on this panel understand well, issues like childcare, basic transportation systems, good paying jobs, decent housing. I mean, those are really the structural. Am I still there? Suddenly I'm freezing on the screen.
We can still hear you.
Okay, good. Those issues are really crucial. So my office, the Governor's Office of Policy, Innovation, and the Future, has been tasked with issues like climate and energy. We staff the Governor's Children's Cabinet. We have a new initiative on affordable housing and workforce housing. Gordon Smith leads the state's work on opioid recovery. And we also work closely across state agencies on workforce and economic development. So obviously it's both a challenging time as we face one of the most significant workforce shortages the state has seen. We're obviously the top of the news this morning is the Central Maine Medical Center talking about cutting back services because of a workforce challenge due to the vaccine mandate. But we're hearing it really in all sectors of the economy, from state employees to bus drivers, to small businesses challenged by workforce. Housing issues, broadband, childcare are obviously the linchpins that help make some of our workforce challenges more viable. I think that while we are in an incredibly challenged environment as we face all these issues, sort of at a time of people feeling burnt out and tired, I will say that the good news is the state is seeing an incredible infusion of federal funds to help make some progress on these policy issues possible. So over the course of the last year, again, the legislature debated, Governor Mills proposed something called the Maine Jobs and Recovery Plan, which is about $1 billion of investment in economic recovery, workforce rebuilding, and really a couple $100 million focused on workforce. Everything from career exploration programs for students, investments in our CTE programs at high schools, specifically huge investments in our community college and higher ed systems for workforce training, and then a variety of other elements of ways of attracting people to our workforce, training healthcare workers, specific apprenticeship programs in the clean energy sector. So a ton of new opportunity to actually build a stronger system of training workers across all sectors of our economy. The plan also invests in our infrastructure, from our childcare systems to our broadband. Obviously, these are one-time shots of money, but they are more significant than anything we've certainly seen in the state in the past. I know both Lisa Miller and Dixie were both struggling with broadband this morning. The American Rescue Plan sends about $150 million to the state of Maine specifically for broadband. So I think at least there is good news in that we finally have an opportunity to make some big investments that are clearly needed to improve people's lives, to improve the sort of basic structures of our state. So I won't talk a lot longer. I'm happy to answer specific questions, but I would say that the opportunity for progress in these areas is helpful and obviously could not come at a more urgent time. I think our state certainly recognizes that the kinds of investments in people's lives and the basic structures of our society are clearly useful and required for our economy, but more importantly for people's lives and public health. I won't talk a lot about climate, but I'm happy Kristina and I work a lot on climate issues together. I will just say, though, that the tremendous challenges of climate disruptions were certainly laid bare this past year in the United States. Maine was able to dodge most of the more significant issues, from hurricanes to heat waves to flooding events. But I will just say that like COVID-19, the challenges that are coming due to climate disruptions are similar to really, they're very similar in many ways, and they are important because they're about people's health. At the basis of climate are people who, especially at the lowest income families, people who live in vulnerable communities, are likely to face the worst consequences. So preparing now, again, through many public health focus areas is incredibly important. I will say Becca Boulis, who from the Maine Public Health Association, has been a leader on these issues. So everything from increased heat events to how we provide good paying jobs in the clean energy sector are really about improving people's lives as well. So happy to get into more of these issues in the Q&A, but again, thank you all for having me, and I think it's an incredibly important and certainly timely discussion.
Thanks so much, Hannah. I want to underscore two themes that we've heard so far from the speakers. One is that Dixie was talking about how her Catholic Charities had built this infrastructure that was relied upon during the pandemic, and laid out kind of a path of hope for how that kind of focus at the ground level can really improve people's lives. And what we just heard from Hannah is that the state is doing the same thing in the policy realm, and with the money that's coming, is building the infrastructure that hopefully will help us weather these challenges like COVID-19, or as climate, as she said at the end, in a way that protects the people that are most vulnerable to these disasters. So thank you very much for that. It's a sobering thing to think about what we've been through and what's coming, but I feel there's a thread of hope that all of you are kind of pulling up that helps us understand where the future is going. And that's a great way to segue to Deb and Lisa, who are pulling together a statewide effort of non-governmental organizations to look at the ways that public health is connected to economic development and these different social determinants of health, and how can we work in a more holistic way across all of the different fields, including public health officials, to try to make sure we have a healthier Maine and a healthier economy. Deb and Lisa?
Great. Thank you so much, Kristina. And this is a great opportunity this morning. I want to thank the panelists and Kristina for doing a great job, and also the folks who are listening this morning. So I'm going to briefly do an intro, then Lisa's going to come on and I'll come back for just a couple of comments at the end. But I want to dial us back to the spring of 2019, pre-COVID. Lisa and I were each about 4 months into our so-called retirements. Lisa is the director of the Bingham program, and me as a senior VP for community health at Maine Health. And we started talking about the big issues that the state was facing: homelessness, food insecurity, lack of jobs that pay a living wage, and more things that you've already heard about this morning. And importantly, we started talking to leaders, people we knew who were on the front lines of these issues. Not that we needed something to do, but we were clearly motivated to take these issues a lot more seriously. The more we heard, the more we were convinced that the link between Maine's economy and the health of our people and communities was the big issue of the day. And remember, this is pre-COVID. Drawing on examples we heard about from that link the health of our people and communities to the social determinants, things you've heard about this morning: food, housing, and the environment. And unfortunately, the traditional silos that have stymied cross-sector solutions in particular. We were convinced that a new coalition was needed to raise awareness of the fundamental link between the health of our people and the economy, and the vital need to invest in infrastructure in the public and private sectors to improve our situations, with a particular focus on vulnerable populations that have historically been marginalized. Our discussions about priorities were informed early on by the Maine Economic Development Strategy, a report that was issued in the fall of 2019 and highlighted virtually all the issues on our priority list, the issues that we heard about. And subsequent to that report, you heard Hannah talk about the Economic Recovery Committee, the Jobs and Recovery Plan. All of these reports and recommendations in them are really, really critical to the work that we're talking about this morning and also about action. Then came COVID, which not only served to shine a spotlight on these issues, as the panelists this morning have talked about, but also the cracks in Maine's fragile public health infrastructure. The Maine Alliance for Health and Prosperity was born out of these discussions. We now have over 25 visionary leaders who are committed to education, policy, and advocacy, using what we call our three-part lens of health, the economy, and equity. That's really what makes this group different. We're grateful to the Bingham Program, the Betterment Fund, and the Soul Foundation for investing in our work to date, and to the Maine Development Foundation for providing a supportive organizational home, which we could not do this work without them. So with that, I'm going to turn it over to Lisa to give you a little flavor of who's part of this organization and what we've been up to.
So thanks, Deb. And if you can share the first slide, just want you all to see that we've gathered a number of, as we call, thought leaders to this work who totally get that there are connections between health, prosperity, and equity. And we call this a partial list. There are a few other folks from philanthropy and some communities of color that will be on the list very soon, but it's a great group of people. And basically, they're there as individuals right now. We are not expecting that they bring the depth and weight of their boards and their own policy systems to this work, but they have vast experience that we've been learning through our meetings has been very helpful. If you can go to the next slide, the first, one of the first pieces of work we've done is this crazy chart, which I don't expect you to be able to read. But in a sense, Hannah teed up a lot of this for us. We wanted to look at the sweet spots, in a sense, between a lot of reports that have come through the state on the economy and the issues that we care about. And the issues we care about are down the left-hand column, and Hannah teed them all up: housing, labor workforce, transportation, equity, public health infrastructure. We were looking to see how all these reports speak about the issues we care about. And across the top, you'll see these reports, like Hannah referenced the Economic Recovery Committee and the Jobs Recovery Plan. There's an Ending Hunger report. There's the actual piece of legislation for distribution of the recovery funds, etc. All of these reports have really lined up very much, talking, speaking, being concerned about all of those structural and social determinants of health that we care about. So in other words, there are a number of leaders throughout the state, and we're thinking, you know, behind all these reports, there could be 200 or 300 different people who weighed in on those, all agreeing that these determinants of health have a lot to do with the economy and that we can't lift our boats all together unless we address these issues. So where am I now? Let's see. So going forward, what we're going to do as an alliance is we're digging in with subgroups on, at least initially, 3 issues. One being housing, one being equity, and a third being a concept called hubs, which we in public health are really interested in. A number of reports are discussing how perhaps we ought to be forming better at the community and regional level to address a number of societal and community problems. And maybe we ought to be thinking about hubs, in a sense, in, you know, really greater Portland Council of Governments is a hub, for example, of governments. So our group wants to look at this concept of hubs, which is appearing in a number of reports as well. So we're kind of digging in to get at the micro level, and we'll have more to talk about in a few months about that. So I'll turn this back over to Deb and we'll wrap up.
Thanks, Lisa. Just a couple of final comments before we go to the Q&A. In terms of, what you might be thinking about, folks who are participating in this session this morning, particularly people who work in the field of public health. And I think we've just put up, you want more information about the Maine Alliance for Health and Prosperity. This is a very limited website at this point on the Maine Development Foundation's website. But we encourage you to go and take a look at what we are doing and the kinds of things that the group has kind of staked out as major issues. I have just a couple of suggestions for folks who are interested in further exploring how health and the economy and taking action, frankly, as public health professionals on these issues. First of all, read those reports that we have identified for you this morning, if you haven't. And it's really important, I think, for public health folks to understand that the issues we care about are reflected, as Lisa reviewed in that crosswalk, how these issues are interconnected. The second thing we'd suggest that you do is join subcommittees and action teams. Many of the initiatives that Hannah talked about are actively soliciting people who want to be involved and taking action and thinking about how funds are going to be spent, et cetera. And then finally, suggesting that you reach out to your town officials, town managers, city managers, town councilors, city councilors, et cetera, with ideas and recommendations about how the millions of dollars that are coming to Maine should be allocated to improve the public's health, whether it's housing or childcare or transportation or food security. These are all issues that we care about from the public health perspective, and getting involved. Town managers want to have input. Lisa and I had the opportunity to meet with a group of them several weeks ago, and they are actively looking for suggestions and recommendations for infrastructure and programs, et cetera, that will in fact improve community and individual health. So with that, I'm going to turn it back to Kristina, who is going to moderate the Q&A session. Thank you.
Thanks, everybody. Those were wonderful introductions. We are going to do some Q&A right here, but I welcome the audience to provide your questions also, and we will be interspersing those with the discussion up here. So please write in with what you would like the panelists to answer. Deb, you ended on this note that I know we struggle with a lot at the Greater Portland Council of Governments, which is how do you integrate these different silos, right? We've got childcare professionals, we have education professionals, workforce, broadband, and then, as Hannah was talking about, she's integrating a lot of that from the Governor's Office of Policy, Innovation, and the Future. Dixie is seeing it on the ground, where she's seeing how these issues interact, and the Alliance is now trying to take a structural approach, a systemic approach to it, perhaps through using these hubs where you could bring together people from different disciplines to plan together and do initiatives together. So I'd like to just explore a little bit what some solutions are. And I'm going to ask you to do something pretty difficult, which is to think about one thing that you think would make the biggest difference, even though we know it's all related. And we heard some things come out, like Jen, you talked a little bit about thinking about the workforce environment, the employer environment for workforce, and how do we make sure that it's more equitable and supportive. And, I heard from Dixie, this idea that maybe at medical facilities, there should be food boxes available for people to take home. And from Hannah, we've got $1 billion in this state that's going to be starting to hit the ground. And Deb also mentioned that it's at the city level, and I'll just put in a really plug, there's a lot of money at the county level also. And so you should be talking to your county commissioners about what you think is important, because that's a much overlooked part of our governmental structure. And there is a lot of money that is landed at the county level. So we have the opportunity to influence investments. So a little bit of background on some of the solutions that you surfaced, but if you had that magic wand and you could wave it, what would be the one thing that could make a really big improvement in Mainers' health? And maybe I'll start with Jen, since she was our first panelist. Would you be willing to jump in?
Wow. Thank you for that question, Kristina. And I sort of, to take it back, I think the question that you ended on was, if we had a pretty much what could fix. But I think going back to sort of how you started the question around integrating the silos and this idea of being cross-cutting. You know, we've used that word, that lingo in public health, cross-cutting. And, you know, at one point I actually looked at the definition of cross-cutting because I'm like, what does that even mean? We use the term so much, and it literally means the linking of what are traditionally independent parties or interests. And right, that's what we do. That's part of the 10 essential public health services. It's what we're sort of is in our blood in public health. So when I think about what would be those recommendations for actually putting that into action, I can think of two things. One is to bring people together around solving a problem. So many times in public health, we've brought people together to talk about the issue. And that's important, don't get me wrong. There's a lot of process conversations that need to happen. But when you say, here is the problem, let's help solve it, you're gonna bring people together from different backgrounds and organizations. And then the other piece that I would just offer is, when we talk about breaking down the silos, we can't forget about that this is about engaging the community members as well. Because in public health, part of our job is not to be the talking head, not to be telling people what to do, but really empowering communities to find their own solutions and put it into action. And to do that, we need to meet people where they're at. And I don't mean that just sort of like philosophically, I mean like physically. We need to like meet people where they're at. So if they are hanging out, if they're working, you know, think about our definition of social determinants of health, where people live, play, pray, work. Like, we need to go to those places to involve our community better.
Jen, that's great. And you know, you talked about importance of convening, and then what we call it, GD call go to them, right? Go to where people are to really understand what's happening. And so, you know, you could, if you're a public health professional that's in the workforce field, you might want to talk a little bit to a childcare expert, right? Because if women, particularly Black women, are the ones that are kind of suffering the most in their workplaces, maybe having some focus on childcare could help. Is that kind of what you're talking about?
Yes. Yeah.
Okay, great. Lisa, please.
Yeah, I'd like to build on that because I think Jen kind of touched on what my response would be. And if I were to wave a wand, I would say I'd really like to see to foster community activation. And yes, across silos, et cetera. But, you know, many of us live in small rural towns. I do, 500 people. And, you know, when we had the big ice storm, who whipped into shape? The fire department. You know, when we had the pandemic, who got activated around food? Our school systems. I mean, they are partners that you would not predict would step up to the plate. They crossed their silo line. And I think we all are embedded in our communities, and communities may be geographic and they may be social in a sense. And I speak to communities of color, for example. I think if we're going to get our work done efficiently and well and deeply, it is because our communities embrace the work. And I think issues of public health, if not the word public health, are really on everyone's lips these days. Mostly good, some not so good, but I think public health has now crossed the line and become more of everyone's daily lives. So let's work with that.
So that's great. I love that example because, you know, I come from the municipality perspective. And one of the things that we saw during the pandemic is that the places that were the most resilient were the places that had pre-existing relationships between sectors. So, for example, when you talk about the fire department and the school department, already knowing people in the public health department, in the Portland area, there's a wonderful example of the restaurants that had to close, started making school lunches for kids, right?
Yeah.
And the schools were paying for that. And then there was transportation that needed to be provided for people to be able to pull that up, pull the food into their households. So that kind of thing happened because people knew each other already and had worked together. And I'm sure, Dixie, you see this on the ground in the county. People know each other, right? And are able to use those relationships for creative solutions.
Yes, absolutely. We had a meeting yesterday because the governor had asked that the counties get together and talk about the challenges and whatnot so that we could look at ending hunger by 2030. And just yesterday, our group decided at the last meeting that was organized at the state level that we would continue on and do the work that was talked about and discussed in that particular panel. So we're continuing that group. We are going to invite more people to the table. And the first meeting that we had independently yesterday, we talked about those very things about us really not understanding what each other do on a really micro level, if you will, because we're all so busy doing it that sometimes you forget that there's others doing some things that might help. So we've talked about inviting each other to do things together so that we can learn more and offer more to the clients that we serve. The other thing I would like to mention that what happened, not only did the restaurants step up and the schools step up during the pandemic at its peak when it first got really tough, but one of the things that I saw, truckers were coming back with things that were being denied because the restaurants were closed. Therefore, the fresh vegetables and fruits were not needed. And also McCain Foods and Pineland up here in the county, we had an abundance of potato products during that time because the restaurants were closed and that kind of thing. So that food was already made and had to go. It's time sensitive. So it came to us and we were in a position to be able to handle it with the infrastructure that we had in place. We could take large scale donations of a tractor trailer truckload of potatoes or potato product in this case, or we could take the onions that were sent to Boston and they weren't able to take them and the truck came back to the county and we were able to take those kinds of things. So we had a lot of wonderful opportunities that came our way. That was what I had a vision of about 20 years ago. I don't ever want to have to say no thanks. And you can't handle it if you don't have the proper infrastructure, the coolers, the freezers, the forklifts, the loading docks, all those things have to be in place. And I've been trying to shake the trees and raise money for years to make sure we have those. But I look at Washington County, they need the same thing. I look at the St. John Valley, they need the same thing. We're serving those areas as best we can, but infrastructure costs money. And I'll certainly be knocking on some doors after this.
That's great. Thank you, Dixie. We have a lot of questions pouring in from the audience. So I'm just going to ask Hannah and Deb to tell us quickly their answer to the magic wand question.
Kristina, the magic wand question is impossible. and I liked the answers so far. I mean, my office does a lot of work on convening, and I do think we've all been very separated by this pandemic, and there are amazing stories of how people have worked together. But I do think, how public health engages with everything from the Chamber of Commerce to municipal leaders. I mean, I think there is such a need for cross-sector work, as Jennifer said well. So I wholeheartedly endorse that. And I thought you were going to make us pick an issue like early childhood versus housing, because I can't decide. I will just actually say though that I think when a lot of this is about policy and funding, in addition to our own human capital and collaboration, and I don't think it's too political to say that what's being debated right now in Washington with the major infrastructure and Build Back Better bill is really about the sort of fundamental human infrastructure that supports families, everything from significant funding for childcare and pre-K to free community college to specific funding for families through the child tax credit to help families be able to, pay for food and keep their families going. So I do think engagement in political and funding arenas is incredibly important, because that is where decisions are being made that could really, fundamentally transform how states, the federal government, and communities build this infrastructure that's required to keep things going. And honestly, to improve, I think we all saw that, hopefully you all saw that New York Times stat about how much America spends on early childhood, and it's about $500 a kid, and we were the lowest of any industrialized nation in the world, or among. So I just think we're obviously in a country that has made some good investments, but we are really underinvesting in some pretty key areas we all know are important. So I'll just leave it at that.
Yeah, thank you so much. I mean, what's happening at the federal level is going to have a huge impact on us if either of those or both of those bills are passed. And, we also know that the amount of money that's already arrived through the 2 relief packages from the federal government, there are some generational opportunities in that. And, Hannah mentioned that there's $1 billion that we've received and it's being programmed at the state level. And then also at the county and the municipal level, there's money still from that same American Rescue Plan Act that has not been programmed yet, that really gives us an opportunity to make some headway on these structural determinants of health challenges. Deb, do you want to wave the magic wand also, or are you going to say,
yeah. Well, just very quickly, because I know we want to go to the audience questions. If I could wave a magic wand, it would be to do away with the political acrimony that is really, I think, stymieing progress on these issues. To be quite frank, these are not Republican issues. They're not Democrat issues, et cetera. These are people and community issues, and we have to invest in infrastructure. And frankly, we have so many assets in the state of Maine. Just as Dixie was talking this morning, many of the panelists, we have many assets, and using the new funding that's coming from Washington and state government, et cetera, to build the infrastructure, both people infrastructure, as Hannah mentioned, as well as infrastructure, be it roads or childcare facilities or new housing opportunities, et cetera, is so important. And just realizing that putting our political baggage at the door and coming together at the community level, the regional level, the state level, to create policies that are going to move quickly is what I would do.
Thank you, Deb. So as we go into these questions, there won't be time for each one of you to answer each question. So I'm going to ask it, just to wave your hand if you're ready to go on it. The first one is probably, it's a really important question, a really hard one to answer. So there's your warning. Systems and structural change often take time. How do we address social determinants of health that need immediate attention without taking a piecemeal approach and waiting while we're waiting for the bigger and structural changes to take shape? Probably the heart of this panel, this question. How do we make immediate action when we know that there are structural changes that are going to take longer to address? Anyone want to?
I mean, I think I would just jump in and say that it's a great and impossible question. I think we are being asked and we are attempting to do both. But I think we need to recognize that that's hard and it's impossible for any one person to attack. I mean, Dixie is on the front lines helping families every single day get the food that they need. And that's sort of the immediate response. And then the long-term system building of funding and communities and infrastructure that can support the long-term is also required. So I think everyone on this panel in many ways is trying to do both. But I think we need to recognize how hard that level of both immediate response and long-term change is. And it's why we're all very tired at this point in the pandemic. But I will say, I do think even the American Rescue Plan that is delivering these funds to Maine that we've been talking about, it is being injected into immediate solutions, everything from COVID vaccinations to helping childcare facilities stay open with just sort of basic dollars to to stay alive. And then it is also investing in infrastructure, for example, to build and expand childcare facilities and pre-K programs. So in a way, I think we have to do both. But again, I'll just say for the third time, it's going to be hard and it's going to be tiring.
Yeah, it is hard because you can see how the immediate needs could consume every last dollar that we have. And yet we also know that we have to work on the structural issues at the same time. And, I think we're probably, like we're all trying to do in our lives, we're trying to balance the different competing demands. And there's no silver bullet answer to that question for sure. Yes, Jen, please weigh in.
I just want to say something really quick because it is a hard, impossible question. And right now I'm taking a class on organizational leadership. And one of the models that we've learned is that leaders during this time could take on 3 characteristics. 1, promote endurance, not speed. 2, be as authentic as possible. And 3, remain positive. So when I think of that question, I think we need endurance because this is long. We need to stay positive because the moment that we think that this is a mountain too big to move, we're going to burn out and we're going to give up. And, and then just remaining authentic. That's what we do in public health. Be authentic, encourage our communities to be authentic, and know that it's just what we're going to need to do.
Thank you guys so much. We have a question here that's specific about the coalition and its work to include Black, Indigenous, people of color led organizations. And I want to, Deb and Lisa, I'll have you answer that, but I want to broaden the question just a little bit to how do we center some of the solutions that we know are needed around the voices and the values that Black, Indigenous, and people of color can bring to the table. But as the others are thinking about that, maybe Lisa and Deb, you can answer the specific question about how the Alliance is addressing having people of color and others at the table, BIPOC people.
So let me take a first stab at that. Well, initially, it is by engaging and reaching out, and as Jen mentioned earlier in her comments, we need to go where people are, and we have engaged several representatives of the Black and Indigenous organizations in the state. But again, people who are visionary leaders who are sitting around the table. We have admittedly said that the issue of equity is central to the Maine Alliance for Health and Prosperity. How we are going to address that specifically, I think, has yet to be developed. We've talked about both how we function internally as an organization, making sure that everyone has the not only opportunity to have voice at the table, but taking responsibility for carrying their views to the rest of the members of the organization and back to their own organizations. We've also talked about how we are going to work on issues that we care about, whether it's housing or childcare, broadband, et cetera, and making sure that there is every effort to engage members of those communities who have lived experience and who understand the issues and the opportunities that lie before us. So I would say it's a work in progress right now for the Alliance. There is not a closed membership. We're really open to people and leaders who want to take and think about these systemic and cross-cutting solutions to the problems that we face. But I'd ask Lisa to weigh in on this as well.
And I'm just going to say we only have 1 minute left. So
Yeah.
Lisa, I'm sorry to
That was
not...
a good response. I would go to the next question because there's so little.
Yeah, I mean, we don't really have time for one next question, except I am going to throw it to Hannah. But Deb, I want to thank you for sharing that and just say that I think a lot of white-led organizations, which there are a lot of them in Maine, are struggling with this question of how to make sure that Black, Indigenous, and people of color are well represented and at the table where decisions are being made. Hannah, the last question for you is really, what kind of organization is tracking all the federal funds that are coming into the state and their allocations, and how do we make sure that as that's happening, we're not deepening silos? And a 30-second answer would be appreciated.
Excellent question. I will say a lot of work is going into that very question about how to be clear about the funds that have come into Maine, specifically the state of Maine, and then transparency on how they're being spent and the outcomes they're having. So I will just say the Maine Jobs and Recovery group, which is led by the governor's administration, will be likely putting up a website in the next couple of weeks that will allow people to see where the funds are going. You can already Google Maine Jobs and Recovery Plan and see where the money was allocated. It's also in LD 1733 if you're good at Googling bills to see all the specific additions the legislature put in. So there has already been a vote on how this money will be spent, and you can track it as it starts to be spent. It goes into law on October 18th, which is next Monday. So more on that, but I think it is incredibly important that it's transparent and people can see how it's happening. The work at the municipal and county level should be the same. So call your town or call your county official and ask them what their plan is and how the community can follow that, the opportunity to really make big investments.
So I want to end our panel on a note of gratitude for all of you who are doing such important work to tie people together, break down silos, work on the front lines, work at the policy level. You're doing extraordinary work. And also with gratitude for everybody in the audience who's been out straight during the pandemic, maybe exhausted, as Hannah said, but trying to move through this with endurance and with positivism. As Jen said, we have some tremendous opportunities ahead of us to really make progress on these persistent issues that are that could create a healthier Maine. So please keep that in mind. Remember that there's a lot of money that's out there. There's a lot of people thinking about this. As public health professionals, please plug in to the different organizations and silos and bring that holistic thinking. So thanks again to the Maine Public Health Association for this invitation to have this plenary panel. It's been tremendous. And thank you again, panelists, for bringing so many great issues to light.